Of our talk today is easy everyday choices that lead to a healthier you. Ever wonder how some people eat a lot but don't gain weight? Is it because they eat healthy foods, exercise a lot, or have a high metabolism? All those things definitely help. But in addition, they probably don't sit around as much. Kind of surprising, right? I like that picture. A Canadian study recently published in 2010, and it was conducted over a dozen years, showed that sitting can be bad for your health, sitting being lack of whole body muscular movement throughout the day, and that time exercising doesn't counteract the time sitting, so moderate to intense exercise won't necessarily make up for lack of movement throughout the day. They're independent effects. That's what they showed in the study. And they found that people who sit less, that have more whole body movement throughout the day, live longer, decreased mortality, as well as decreased obesity, decreased heart disease, decreased diabetes, and a number of other associations. So apparently small movements, in regards to obesity specifically, small movements throughout the day burn off a lot of calories.
I heard that, yeah, small movements are almost as good as strenuous exercise as far as burning calories. The body's so efficient.
Definitely a cumulative effect, yeah, throughout the day.
It doesn't burn that much more.
And so making little movements throughout the day can make a big difference. And some people who don't gain weight while eating may unconsciously be moving more throughout the day. And so if sitting less and moving more make that big of a difference, and how much more will regularly eating healthy, drinking lots of water, incorporating planned exercise, getting a good night's sleep, reducing life stress, and maintaining social and spiritual connectedness. So in improving each of these areas, does that necessarily mean making difficult life changes? No, why should it? Real long-lasting changes can start with baby steps, with small changes. So how can we start making these small changes? We fill our day with eating, sleeping, going to work, chatting, exercising here and there. So what little things can we do to switch up in our day? Well, to get started, just to kind of go along with the beginning of this talk, let's kind of stand up, move our feet, if you guys like. Kind of wave your arms around. It's kind of an example of small movements that you can do throughout the day, just to kind of keep that whole body muscular activity that we were just talking about. Yeah, I mean, yeah, in between
little moments.
Yeah, I mean, in any small break. So it feels pretty good. I like just the movement right now. But yeah, here's another picture that I like quite a bit. No idea how they set up that photo, but pretty cool looking. So we can kind of relax and continue if you guys want. So eating is an integral part of all of our days, and something that's pretty easy to improve. And so why not make healthy replacements in food choices? So instead of eating lots of meats and dairy products, we can eat more fruit and vegetables. Some substitutions that are pretty easy to make. Lentils or beans with rice are pretty filling and more healthy than red meat. We all know that meat consumption is associated with increased morbidity and mortality, right? Specifically heart disease, certain forms of cancer, other stuff. So it's good to avoid the meat, substitute other stuff such as lentils. You can eat trail mix rather than potato chips. The trail mix containing raisins and nuts. Nut studies originating here in Loma Linda show increased nut consumptions associated with decreased risk for coronary heart disease as well as other benefits. So it's a good substitution. Nuts are a good thing to include in your day. As far as water, many of us, myself included, could benefit from more water throughout the day. Water is good for the kidneys, the rest of the body, helps keep the skin looking youthful, and also another study here originating in Loma Linda based on Adventist Health Study 1 data decreased risk of coronary heart disease with increased water consumption. So many benefits.
No, it doesn't, basically it does basically the same thing aspirin would do, it just thins your blood.
I'm not sure of the mechanism, they just showed the association, they didn't kind of prove the mechanism.
No, but that is right.
Yeah.
It's a thinning process. I mean, the most, I would say, probably the mechanism.
That's interesting.
Because the viscosity of the blood is thicker, it's going to make your heart work harder. See, that's the concept. So
Definitely
thinner,
makes sense intuitively.
it's going to it's beating with less stress.
And one easy way to drink more water, and I've seen a lot of my friends do this, is just kind of carrying a water bottle. And if it's on hand, you're much more likely to drink the stuff. And it doesn't have to be bottled water that you buy either. I mean, there's containers you can use. For anybody worried about plastics, you can use stainless steel containers. If you're worried about BPA or any of the other stuff in plastics. Whenever I have a backpack, I try to do that, and I found with myself that I tend to drink more.
By the way, talking about BPA's, I heard a couple weeks ago that they noticed that women, well, say young girls, were more apt to have stresses or ADD or different things drinking out of plastic bottles. They haven't seen anything with men, but
Interesting. I know with the rat studies, they showed some endocrine disruption with the stuff at levels that are below the threshold that is set for safe by the government. Interesting. I'll have to read up on that. Actually, like that you mentioned. Thanks. So exercising is another good thing. Exercise done throughout the day in small spurts is good. And additionally, if you get a chance to be outside, you can increase your vitamin D by getting some sun.
Melanoma.
Yeah, I thought about mentioning that. You gotta balance that off with like skin cancer risk, so you can supplement with vitamin D equally as well.
so what have they found anything else that's just taking a supplement rather than getting that sun exposure?
My understanding is that supplemental vitamin D3 is equally effective. Is that correct, Dr. Dos Santos?
Yes. Well, it's still a controversy. With vitamin D is still controversy. My advice is that check your levels. If it's less than 25 micrograms or whatever, microliters, whatever, 25, then you have to take some supplements because your sun is not big enough. And it's interesting that in California, with all this sun, many people are deficient in vitamin D because with all this sun, we stay inside.
Yeah, that's right. Yeah, my mother actually, she was low on vitamin D, and it's very important for your immune system, and I think she had some other kind of maybe digestive situation or something is what caused her to go in and get checked. That was what the problem was.
So just ask your doctor when you go to a checkup to check your vitamin D levels.
So it's something that people should be worried. Now, who knows in here how much sun we need? Exposure every day.
As low as 1,500 a day is supposed to be.
Right, yeah. But children, how about children?
Most of them get a lot more soon.
A lot more. An hour and 40 minutes. An hour and 40 minutes. I try to take my kids out 2 hours a day. That pretty much probably covers that. I also have supplements.
So as far as some easy ways to incorporate exercise throughout the day, going on small walks when you talk, stretching around, moving in your workspace like we just kind of practiced, taking the stairs rather than the elevator. I know myself, something I been trying to do recently is, when going to the mall, rather than if parking's kind of full, rather than driving around and waiting for a closed parking lot, just parking farther away and walking in actually saves time most of the time for me. You get the added benefit of the, what's that?
It saves gas too.
Yeah.
And fewer dents and scratches on your car.
Yeah. And another important thing is being well rested. I know myself, if I don't get very much sleep, like I don't feel very energetic the next day. And one of the important things as far as that is consistency, keeping the same sleep schedule throughout the week. A lot of people, myself included, have a tendency to kind of sleep in on the weekends, sleep and have a kind of shifted sleep schedule. And that actually disrupts like the sleep schedule for the rest of the week.
Yeah, that's what I told my wife. My son is 4, but he's not in he's in preschool. But to keep that consistent schedule, because he has to get up like 6 o'clock in the morning to catch the bus at 7 already. So it's and sleep I think is more important for the younger ones for their development too, growth and mental development. There's another question about sleep though. If you're very active sleeper, say, is that a good thing or a bad thing? Maybe that's a little both, but.
As far as moving a lot.
Yeah, right. Restless sleepers, the type that their head is, where their feet should be by the end of the night or something like that, or their covers are all over.
Some things you can kind of practice to improve your sleep. Also, having a winding down period, 30 minutes before heading off to bed. No controversial conversations or stimulating things like computer screens or TVs. Setting the right mood. And having just a comfortable bed, whatever comfortable is for you. And
just the memory foam, is there really value in those or not?
I just have the reason that's included is just I have some friends that swear by this stuff. Like they really feel much more comfortable with that than whatever the mattresses were underneath for them. So for them, that seemed to be more comfortable.
I was going to ask you about that too.
That's kind of novel.
Yeah.
Yeah.
I have a Tempur-Pedic, it's good. But I've heard the ones that they have the air you can adjust to are good. But I don't know about that really. If that's what
It's all pretty subjective. Some people like harder, firmer mattresses. Other people like softer. So it's wherever you're comfortable with. Stress management is also pretty important. And managing stress correctly allows for feel healthier, be more productive. Some things you can do in stress management is taking a short time out during stressful periods of time and unwinding with a small walk or other exercise. Getting outside, just in nature, whenever you can, and separating yourself from the day stress while connecting with something positive.
Ooh.
Beautiful, huh?
Oh, beautiful.
And staying connected spiritually and socially, an important aspect. Stay in contact with friends and family members, regularly catching up. Being part of community, just going to church and going to Blue Zone Sabbath School is part of that. Keeping open, positive energy. I know as far as staying connected spiritually, I've recently, within the last year, started, for myself, began like a regular daily devotional in the morning. And I found that it makes me feel kind of centered, focused, and kind of sets off the whole day. So I enjoy that myself, and that's something I recently started doing. So I recommend it for anybody that hasn't yet kind of experienced that.
I would say too that I used to, reading my Bible at nighttime, just 10 or 15 minutes, or even a passage, and just meditating on that, focusing on that. And before bed, people with restless sleep, perhaps, or nightmares, things like that. That's really an amazing difference.
Kind of set the mood for good night's sleep.
Exactly. Well, actually, they say that whatever your thought before you go to bed, you'll pretty much have that thought in the morning too, or that feeling. Because if you're stressed, so you should, as the Bible teaches, we should, be at peace with anyone before bed. Doesn't it say that? Before we go to bed. So, there's wisdom there.
So improvements in your health are within your reach. Don't feel overwhelmed. Making small changes in your life. By making small changes, you'll start experiencing real health benefits, and they'll come sooner than you think. And any of the studies that I mentioned, I'd be happy to provide the primary papers to any of you guys that are interested. If so, just ask me and I'll give you my email for the nut studies, water, movement throughout the day, any of that stuff. Be happy to provide those.
Now with the water, is it okay? You know, it's